The New Ulm Medical Center Foundation and its donors are major supporters of the New Ulm Medical Center, a nationally recognized healthcare facility in New Ulm, Minnesota. New Ulm Medical Center, part of Allina Health, is a nonprofit hospital and clinic serving the region in and around Brown County, located in south central Minnesota. Together, we partner on 6 strategic pillars of care: the Heart of New Ulm Project, mental health and addiction services, the Medical Surgical Care Unit, cancer care, hospice care and senior care, and neurology care. We offer an extensive range of care options with over 30 affiliated physicians, a full complement of visiting specialists, and over 20 specialty care services that will exceed your expectations. We believe whole person care is an approach that recognizes all factors impacting health are connected: mind, body, spirit, and community. From our birth center to hospice, we coordinate care so that you don't have to. We provide ease of access, online convenience, a simplified, supportive way of navigating services for our patients and their families, as well as coordinated, integrated, and affordable care. We invest in our talent by fostering a relationship-driven culture rooted in our values. We empower and support employees so they can focus on delivering exceptional care. We offer care guides, care management, and efforts to help prevent emergency visits. New Ulm Medical Center received the Award for Innovation of the Year in Patient Care, which recognized our social worker program for providing superior care coordination services to our emergency department and clinic patients.
Number one has to be getting to know the patient. Really asking about the family and knowing what's going on with the grandkids, their special interest. I think that's really what starts the relationship. I think another very important thing is sometimes knowing what their agenda is. Patients sometimes come in and we may be on different ends of the spectrum as far as what's going on or what questions or concerns they might have, and kind of reaffirming what questions you need me to help answer today, or what are you concerned about, to make sure you're getting the right questions answered. I feel like our group really puts the care of the patient first. They care about the patient just as much as we do from a primary care standpoint. It really is a small town feel where we really want to get to know our patients and care for our patients.
New Ulm Medical Center was named one of the top 100 critical access hospitals in the United States by the Chartis Center for Rural Health for the 7th time in 8 years. New Ulm Medical Center is the only hospital in Minnesota to make this list 7 times. New Ulm Medical Center Foundation is the full funding source for the Heart of New Ulm project at $150,000 annually. The project is guided by a 12-member community leadership team and many volunteers who focus on 3 significant and widespread health issues: healthy lifestyles across the lifespan, addiction and risky use of substances, and mental health. Project research shows that over a 6-year period, New Ulm residents are doing better in controlling their blood pressure, LDL cholesterol, total cholesterol, and triglycerides. In 2018, the project received the Heart Healthy Stroke Free Award from the National Forum for Heart Disease and Stroke Prevention in Washington, D.C. The Heart of New Ulm project is a model for other communities to look to for improving heart disease risk factors, ultimately reducing heart attacks. The positive impacts that have been achieved are exciting and inspiring for others, not just locally, but across the United States. Today, we have patients with a higher mental health need, which also impacts addiction issues. As partners, New Ulm Medical Center and the Foundation work together every day at improving awareness and reducing stigma around mental health and addiction. A recent study by the U.S. Department of Health and Human Services concluded that 1 in 5 American adults experienced a mental health issue, 1 in 10 young people experienced a period of major depression, and 1 in 25 Americans lived with a serious mental health illness, such as schizophrenia, bipolar disorder, or major depression. Today, suicide is the 10th leading cause of death in the United States. It accounts for the loss of more than 41,000 American lives each year, more than double the number of lives lost to homicide. New Ulm Medical Center also offers chemical dependency assessments and provides residential and outpatient treatment. The National Institute on Drug Abuse reported that 25% of people who misused prescription drugs by age 13 ended up with an addiction at some point in their life. The New Ulm Medical Center and Foundation support our patients by getting them back into the routine of life and building skills through education and activities. We create a healing and welcoming environment where people know we care about their overall health, mentally and physically. If you need medical treatment that requires at least one overnight stay, you'll be admitted to New Ulm Medical Center's Medical Surgical Care Unit. It is thanks to all of our great donors that we are able to offer private patient rooms with televisions and wireless high-speed internet. Everything we do is designed to meet your needs in an atmosphere that promotes healing and comfort. Our nursing staff's response rate and level of personalized, skilled care is second to none. While in the hospital, you will be cared for by a doctor known as a hospitalist. Hospitalists are doctors who specialize in diagnosing, treating, and coordinating the care of patients while in the hospital. Donors today are supporting our inpatient unit so we can continue to provide a healing environment for our patients, their visitors, and family members. The Virginia Piper Cancer Institute at New Ulm Medical Center was made possible by over 1,500 donors who helped us create this excellent outpatient care area that is individually tailored and convenient for more than 6,000 patient visits per year. Our on-site oncologists, nurses, and pharmacists work collaboratively to provide compassionate care based on the unique needs of each patient. They address the emotional needs as well as the physical needs of each patient. Our staff assist with scheduling follow-up appointments and tests, as well as providing care for patients requiring infusion therapy, such as low iron and rheumatoid arthritis. The added events of anniversaries and celebrations come often with our caring staff and great volunteers. Because of the donors who support the Patient Assistance Fund, we are there for our patients at their greatest time of need, using our Patient Assistance Fund for prescription, nutritional supplements, gas, and grocery needs. We evaluate each patient based on their needs using our care coordinator and social worker in the cancer center. The National Cancer Institute reported that 38% of men and women will be diagnosed with cancer during their lifetime. If you or a loved one is diagnosed with cancer, we will do our very best to ensure you can stay close to home for your care and treatment. Your donations support over $50,000 annually to provide the best care to our senior population, so we can provide care wherever our seniors are. Whether home is an apartment, assisted living, or nursing home, we are here to keep seniors healthy. From palliative care, spiritual and chaplain care, to hospice care or respite and bereavement care, our team is dedicated to ensuring your dignity and protecting you during your senior years. We also offer complementary programs such as music and massage therapy for our hospice patients. Neurologists at New Ulm Medical Center are passionate about epilepsy and dementia care, dizziness and vertigo, Parkinson's disease, headaches, and multiple sclerosis. Our neurology department supports open and honest relationships with our patients and encourages understanding through education. We continue to build our neuroscience program for the aging population. We have a continued need for donor partnerships to help us create an autonomics lab, which will support neuropathy and fainting evaluations. If you have an interest to support neurology at New Ulm Medical Center, now is the time to make an impact.
There's been kind of a fairly steady growth pattern in terms of more and more sophisticated tests or specialists, which you used to have to go to the Twin Cities for. Now you get it done here. Working here is rather more almost a study in efficiency. The attitude of let's try to get that done is much higher.
New Ulm was rated one of the top 10 cities in America to live by USA Today. New Ulm Medical Center continues to be one of the most recognized rural health performers in the state, year after year.
Unfortunately, we've seen throughout the country and in our own region lots of hospitals closing. We've been lucky here in New Ulm Medical Center in that we've been able to sustain and expand the services. We have the capacity right now to do video visits. Your doctor can talk to you from the clinic to you in your home, wear an Apple Watch and have it record your heart rate and have that go to your doctor and nurse so that you can work on a health plan. I think that sort of technology and that sort of thinking is a potential to transform how we do medicine. The New Ulm Medical Center Foundation has been really integral, has been a key to the success of the New Ulm Medical Center. Having a full-time neurologist in a town of this size is incredible, and 3D mammography and breast stereotactic biopsy. The support of the community and the foundation allow us to do things we wouldn't be able to do.
Donors like you play an important role on our team. Like our dedicated caregivers at New Ulm Medical Center, you help us discover new approaches that lead to the best treatment outcomes for our patients. You help us take care of the things that matter the most when our patients need us. You help us change lives. From community wellness, cancer care, and end-of-life care to emergency services and delivering babies, New Ulm Medical Center plays a vital role in the health of our community. Today, the medical center is stronger than ever thanks to you. Your partnership supports compassionate and innovative care, keeping you and your loved ones close to home.